executive orders have been an eye-opener, yes, but we had started the process, and it has helped us now to quickly finalize the roadmap that provides guidance to all the actors in the HIV area to ensure that we are offering services within our means. And this roadmap has been finalized. It will be presented to Cabinet, and once Cabinet is assent to it, then it will be taken to all the government sectors and all organizations and entities that support government to make sure that services are offered in using a holistic approach, using an integrated approach, but importantly, delivered with government in the lead and communities and sectors implementing government priorities. But I wanted to use this opportunity to assure the public that services have not been interrupted because of the uncertainty that we've been going through. Services still exist, services are still ongoing, and members of the public are encouraged to continue going to their nearest health facilities to access these services. So please focus on dissemination of accurate HIV prevention messages. Focus on channels that can take this message to the young people, adolescent girls and young women, because, as I said, the transmission is up to 4 times in this group more than it is in the young people. As I conclude, Madam Chairperson and all the members present here, I want to call the general public to stand in solidarity with His Excellency the President, who has challenged us to end AIDS as a public health threat by 2030. And how can the public play their role? Let's all endeavor to avoid risky sexual behaviors and protect ourselves and our loved ones. Let's go and take an HIV test so that we are able to know our HIV status. As I said, HIV testing services are available across the country, in all health facilities across the country. Wherever you go, you will access this service. Some of these test kits are actually also accessible in the private pharmacies across the country.